This is the Dental Up Podcast, your daily source for insights from dentists and leaders in the industry. Brought to you by Keating Dental Lab, a full-service, award-winning dental lab that is here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.
Welcome to the Dental Hub Podcast. Today's guest is Frederik Marcil from Kube Innovations, located in Montreal, Canada. Fred, good afternoon and welcome to the Dental Hub Podcast.
Hi, Robert. Thank you so much for having me on this podcast. Very excited about it.
Absolutely. You have a fantastic product that I was lucky enough to test myself at the VA convention a month ago in Houston, and I thought it was fantastic. But before we get into that and the nuts and bolts, what I'd like for you to do is, Fred, give us an overview of your company and tell us about the technology and the importance of measuring bite force in the clinic's office.
Wonderful. The company, Kube Innovation, I founded that company over 7 years ago now. We're based in Montreal, Canada. And the vision of this company was to bring a new bite force measuring device to the market. Now, the goal for that was to improve the treatment acceptance rate by using a biometric standard. And what I mean by that is with the Innobyte, our product, you can quickly measure the bite force of the patient coming into a clinic, get the total force in Newton, and then use that to explain and demonstrate to the patient the need for treatment. So it's a really very effective tool to do that. And it's also very easy to use.
I agree with everything you said. And again, I was a test subject on the show floor and I was amazed, number one, at how quick it was. But number two, most importantly, I think, was how easy and how visual your product is so the patients can interpret the results in quite a simple manner.
Absolutely. When I've designed this product a few years back, one of my goal was to make sure that my grandmother could measure the bite force of anyone without any instructions. So that's why I was very particular, if I may say, on some of the design choices. For example, there's no on-off button. The device is just going to go to sleep, wake up whenever you need it. And that way it's one less step to consider and to train anyone that is going to be using the product after.
So ideally, this will be something that the dental assistants can use on the patient, measure the bite force prior to the dentist coming into the room.
That's absolutely right. This is what we always recommend. And so it's literally, I would say, 10 seconds in total. We put a plastic bag on a silicone arch that we insert in the patient's mouth. We call that part the mouthpiece. And then we give instructions to the patient to apply the maximum bite force. So basically chewing and squeezing as hard as they can, the mouthpiece, that's going to get translated into a digital value on the display. And it's going to give the clinician the total force in Newton. They can then use that information to correlate with the biometric standard that is provided with the product, which is basically a simple chart. You might have seen it. And
Good.
It's showing you what is a normal force, what is an excessive force, and what is a deficient force as well. So again, very simple, quick, and user-friendly.
Yeah, and that was fantastic. And again, so easy to understand. In terms of the numerical values, why don't you walk us through what the average human can generate and what is light, what is excessive, and how this affects treatment planning decisions?
Wonderful. So the first thing, we had to do is, since it was a new product, and as a matter of fact, it is the first and only bite force measuring device on the market still to this day, we had to create a standard because nobody had looked at what is a normal bite force for a male 60 years old. There was some literature and scientific publications, but not really a consensus that could be used in a clinical setting. So we had to measure over 500 patients of all age, all sex, and all conditions. We then correlated the results of that with a statistical analysis to create an initial chart. And then with these results, we used them to look at what was in the most recent publications out there in some really well-regarded journals. And then we figured out that we were exactly aligned with the most regarded publications. And so that's how we created the initial standard. Now, then after that comes the clinical applications of having the bite force of the patient correlated with the bite force reference chart And then we can see, for example, when a patient has a deficient bite force, we're going to often be looking at partially and fully edentulous patients. And as we know, these patients have a really low bite force, but now we can put a number on it. And it's such an eye opening experience for the patient to go through the process of getting the bite force measured, seeing the result, and seeing that, for example, they're applying a 109 Newton bite force. To put things in perspective, a normal bite force, the gender is or age is between 650 Newton to 1000 Newton. To give you another example, I like to use that as well, is to be able to eat a steak properly, you need at least 650 Newton. So again, if we go back to that patient with 109 Newton, there's no way that patient can eat a steak unless you cut in small pieces and you swallow whole the parts, which is ultimately it's going to impact the quality of their life.
I couldn't imagine being able to myself only generate a bite force of 109 newtons. Steak's my favorite, and a lot of other foods that are higher up on the table there. My personal life would suffer if I couldn't eat those types of foods.
Absolutely. And it's this cascading effect on different effect on the body, because as we know, eating and the mastication is the basis of our health. If we can't do that properly, then there's so many other problems that can arrive and come. So it's so important to educate patient with bite force limitation on the importance to change the situation and basically give them back their life with
Right.
dental implants, for example.
There's a whole lot of treatment modalities that, the dentist and the clinician can address when there's limited bite force generations. But conversely, on the opposite side of the spectrum, and I was one of those guys when I was testing your invention in Houston last month, before Marianne and Autumn even really showed it to me, I was like, I'm going to be off the charts. I'm going to be over 1,000. And sure enough, I measured over 1,000 and I wasn't even really clenching that hard. What should dentists speak to their patients about when they're at that 1,000 level and above?
So there's a lot of different treatment plan options. There's also different schools of thought that we need to keep in mind. But we like to work with evidence based as much as possible. So, what we can see in the literature is a few things. For example, there's a lot of data showing nighttime appliances such as Night Guard can help decrease and re educate the muscles, the masseters, for example, and temporalis, to start applying a little bit less force over time. Also, these appliances, as we know, are opening up the vertical dimension, which is then changing the proprioceptions and then contributing to decreasing the maximum bite force. Now, what's also a big issue with people like yourself that are applying an excessive force is if you can apply over 1,000, which is again an excessive force during the daytime, the literature is saying that if you're suffering from power functions such as bruxism, clenching, or others, you can apply at least 2 to 3 times the maximum voluntary bite force you can apply during the daytime. Because as at nighttime, you don't really have the same feedback, the same proprioception, so you don't control as much the force you can apply. And that's really when the dental labs are concerned, because that's when we see zirconia chipping on full arch fixed cases. That's why we see all kinds of catastrophic material failures. So it's really critical to identify that during the daytime to make the proper clinical recommendations, treatment plan design, and material selection as a function of the force.
And me personally, as a lab technician, I would love to have every single patient's bite force number on the prescription, because if somebody wants straight feldspathic porcelain and their bite force generation is 1,000 newtons, I'm going to say, nope, we can't do that. We need to go to monolithic zirconia. That's our number one problem in the lab is broken glass, broken restorations. And not this lab, but I'm sure every lab worldwide would really benefit from more patients using your invention and testing their bite force and having that number recorded. It could really steer the dentists and laboratories into making better decisions.
Absolutely. And I like to say that it helps clinicians get a peace of mind when they're doing a treatment plan, especially full mouth reconstructions. As we know, sometimes it can get tricky when there's a lot of implants, fixed cases, especially. I think it's so important as an engineer, coming from a background where I'm used to have a number to justify every decision and support every kind of treatment plan and design choices, to have some data for the dentist to say, okay, this is going to be the treatment plan. This is how I think we're going to have the best chances of success. And it's a win for the dentist, and it's also a win for the patient because they get the best treatment plan. They prevent failures, so the dentist is happy, and also the patient, don't have to come back.
That's what evidence-based dentistry is all about, is identifying the weakest link in the system and engineering a way around or through that weakest link and really preventing future problems. I'm all on board with this, and I'd love more Keating customers to test your invention live in their office. Let everybody know what we've discussed and the plan on how to get the Innobyte into more dentist office.
Absolutely. Thank you, Robert, for that. And I'm very pleased to announce on this podcast that Keating Dental is going to be very innovative, and they're going to be the first dental lab in the US to have an inventory of Innobyte available for their clients. So if ever you'd like to test the Innobyte and measure bite force in your clinic, you can reach out to Keating Dental and they can get you a unit for a few days to test with patients. So I really want to thank Keating Dental for collaborating with us. And I think for your clients, it's going to be a really major added value to your dental lab.
I see a lot of really positive things and better treatment planning. I think if the patient sees that number 1,000, and I've been thinking ever since I got back from the Houston show that, man, I need to make myself a night guard. I need to make myself a deprogrammer again. And I need to diminish my bite force because I see the effects on myself. I see my, maxillary incisal edges flattening out and chipping. And yeah, I know. As being a technician for almost 30 years, I know what that's caused by. If patients can see that number and they can see the evidence in their own mouth, I think that it'll help the patients make better decisions on their treatment as well.
Absolutely. And it's just interesting what you just mentioned, because I'd like to circle back on new clinical application that has been really growing. And I see a big trend and especially US based dentists looking at adding this new procedure to practice. And there's more and more clinicians that are looking into Botox now, Botox injections in the masseter and sometimes in the temporalis as well to reduce really excessive bite force. I'm talking about 1,300, 1,500 Newton bite force. And I've seen a few patients like that that are sometimes in chronic pain. And one of the potential solutions is to, again, just inject some Botox. Honestly, I've seen many patients doing it, and it's so impressive, the effect, because the bite force is dramatically decreasing. And so much actually that I'm actually personally a little bit concerned sometimes, because when we're injecting Botox and perhaps the quantity and the frequency of the injections may be too high, the bite force goes down so low. I've seen a lot of patients that could barely apply more than 300 Newton. And previously they were applying over 1,400 Newton. So
Oh, wow.
again,
That's
it's
significant.
it's a huge decrease, but it's so big in terms of a decrease that perhaps we should be injecting the patient with a little bit less quantity and perhaps a bigger interval of time in between the injections, just to make sure that we keep them in a normal range of force between 650 to 1,000. Again, it gives the dentist a tool to not go blind to the procedure when they're looking at Botox.
Yeah, titrating the dosage so that you don't experience too rapid or too significant a decline in bite force generation is very important. It's like everything, though. You got to get the dosage right. And sometimes you overshoot it and there's dramatic effects. Sometimes you underdose and there's no effect, no positive effect. But yeah, titrating the dosage to that 650 number is very important. Yeah, and the Botox courses that we've had here at the lab, those are some of our best-selling courses, and I know that it's a big item of interest for US based, particularly the dentists in Southern California. It's a huge item of interest for them.
And it's interesting because what I've read a little bit in the literature is post COVID, for some reason, we're not quite sure why, but there seems to be an increase of number of people suffering from parafunctions, bruxism, clenching, chronic pain at the TMJ, and that is often translating in TMD. And so I guess people are just a little bit more stressed out post pandemic. So I think it's just even more important to prevent rather than treat. And I think Bite Force can be a tool to achieve just that.
Absolutely. That's a great point. Here at Keating, we've made more night guards this year than any other year in our history. And I couldn't agree more. I think people are stressed out, and the pandemic changed many lives across the world. And yeah, that translates into stress. That translates into parafunctional nighttime habits. And that translates into broken teeth, broken restorations, and night guards are such a simple tool to alleviate and prevent some of these failures that we're seeing.
Absolutely. And I think Keating Dental Lab is definitely a great place for these night guards because I think, again, from what I've seen in terms of clinical cases, night guards can definitely help reduce excessive forces and help the patient. Furthermore, I find that, and that's some feedback we've been getting from some of our clients and users, that once they measure the bite force of the patient, they demonstrate that over 1,000 Newton, the patient is getting a night guard. Compliance can be an issue for some people. And what we've learned
Sure.
in the feedback survey is because people are realizing and seeing the value of their force, they tend to wear their night guard more. So again, another advantage to demonstrating and quantifying what's going on to the patient.
Fred, tell us where the Innobyte is available in the United States. How can a dentist listening to our program today make a purchase?
So we're very excited to now be working with a very dynamic US distributor, which is called Andau Medical Inc. So they are working very closely with us in the US to bring the Innobyte to every single dental clinic. And so I would strongly encourage you to either get in touch with Keating Dental Lab that can make a liaison to Andau Medical, or you can find them online, Andau Medical Inc. You can find them in Google. You're going to see the Innobyte is on their website as well. You can get all kinds of information, and they're going to be more than happy to assist you and to come and see you in your clinic to give you more information or look at the product with you.
We're going to post all those links on the text portion of this program. So we'll have links to Kube Innovation, to Andau Medical, and the Loaner Program that dentists can sign up for here through Keating Dental Lab.
That's really wonderful. I'm very excited about this new opportunity. I think, again, dentists and clinicians, please get a loaner, test it, have fun. You're going to see it's really exciting to measure your patient, and also it's exciting to measure all your staff. And just to see it always becomes a challenge in a game to see who's biting the hardest. So I can guarantee you're going to be surprised.
Oh, absolutely. And I was a test subject myself, and it took about 20 seconds to clean and put a new plastic protective sleeve on, and about 10 seconds to measure my bite force. So it's so simple, so easy to use. You've done all the work in your design to make it really efficient for use in the clinician's office.
Absolutely, because we know clinicians are busy. There's a lot of turnover also post pandemic in terms of the staff sometimes. This is a great product for that as well because there's literally no training required to use it. We do, however, provide if for anyone a free 15-minute training to just make you very comfortable with the product. But you'll see, Robert, as you said, it's just so easy to use. It's literally 2 minutes training, you're ready to go.
Yep, absolutely. Fred, thank you so much for your time. I really appreciate you coming on today and being our guest on the Dental Up podcast. Again, the company is called Kube Innovation, and it's available in the United States through Andau Medical. And the product we've been talking about is called the Innobyte.
Robert, thank you so much to you and Keating Dental for this awesome opportunity. It was really great. Thank you for this podcast.
Thank you, Fred. Be well. You've got a fantastic product. Now we just need more exposure and more dentists using it, and everybody's going to benefit. The patient's going to benefit. The practice is going to benefit. Dental labs are going to benefit from your invention. It's a great thing you came up with. I appreciate it.
Thank you so much for these kind words. I truly appreciate it.
Thanks, Fred. Be well. Have a great weekend.
Thank you for listening to the Dental Up podcast, your daily source for insights from dentists and leaders in the industry. This episode is sponsored by Keating Dental Lab, here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products, and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.